If you do A-level PE and you're struggling with cardiovascular values, listen up to this. So cardiac output is your stroke volume times by your heart rate. And your cardiac output is the volume of blood ejected from the left ventricle per minute. And that's measured in litres per minute. Your stroke volume is very similar to that. So it's still the volume of blood being ejected from the left ventricle, but it's per beat this time. So we measure that in millilitres or millilitres per beat. And then heart rate is the number of times the heart beats per minute, measured in beats per minute. And roughly your cardiac output is about 5 litres per minute at rest. And that can increase to anything between 20 to 40 litres per minute during maximal exercise. Your stroke volume is roughly around 80 millilitres per beat at rest. And that can increase to anything between 100 to 140 millilitres. And then your heart rate is roughly around 70 beats per minute at rest. And then maximally, to estimate it, you would do 220 minus your age. Now, what they could also ask about here is how these values differ between a trained and an untrained athlete. And a trained athlete would always have a higher stroke volume, and that would result in them having a lower resting heart rate. And if they ask about why any of these three are different between trained and untrained, the answer is always to do with cardiac hypertrophy. So let's say this is the trained athlete's heart. The trained athlete will have a lot more cardiac hypertrophy in the wall of the left ventricle. And that will just mean that their left ventricle is stronger. So when it contracts, it's able to force out more blood per beat, which is stroke volume. And that means that their resting heart rate can be lower.